Hello and welcome back to the Ophthalmic Referrals series. My name is Christian, I'm an optometrist, and the aim of this series is to offer some helpful hints and tips to my optometry colleagues in primary care who are making referrals to ophthalmology. In this episode we'll talk about low vision referrals. I would encourage you to watch the first episode in this series, which will cover the generic information that we should include in all ophthalmology referrals, and that will underpin all the episodes in this series. Please remember that this is how I would process a patient requiring a low vision referral, and you must of course use your professional judgment and follow any local and national guidelines and policies that are in effect. Let's start off by talking about the types of referrals that we would send to the low vision service. There is a difference between the low vision clinic and a request for a certification of visual impairment. So as you'll be familiar, the low vision service is usually delivered by either an optometrist or an orthoptist or a dispensing optician who's typically undergone some additional training in low vision services. You'll be aware of the key components of those particular assessments, and I've listed them here for your information. To contrast that with a patient who requires a certification of visual impairment, so that's either being certified as sight impaired or severely sight impaired, and as you know, the old terms for that were partially sighted or blind. Usually this will be done by a consultant ophthalmologist, so if you want somebody to have a certificate of visual impairment, or CVI as they're known, you'll need to refer that patient to the most appropriate clinic. And in this case, if for example it's macular disease which is causing them to be potentially sight impaired, you'd send them to a medical retina clinic for that certification. Glaucoma is obviously enough, that would go to the glaucoma clinic. And then if you're looking at cerebrovascular disease, then probably a neuro-ophthalmology clinic. And if it's diabetic medical retinal disease, then they'd go to the diabetic medical retina clinic. Let's start off with the basics. You want, as usual, refractive error and monocular VA. It's helpful to list the cause of the reduced VA in each eye and how long it's been like that for. Is this a new problem, or is it something that somebody's had for many years? Are they currently under the care of an ophthalmologist? Are they having difficulties with specific tasks? Is it an occupational problem? Is it activities of daily living? Is it a hobby? And when you're considering referral urgency, many low vision referrals are made routinely, but there are some factors which might cause you to escalate that to an urgent referral. For example, are they at risk in the home? Is there a history of depression? Is there a fall risk? Once we've got the basics right, then we may look to upgrade our low vision referrals. Firstly, to give an idea of the patient's preferred near working distance. Secondly, the previous visual acuity with the date, and this will help to give an idea of the previous visual potential of the eye. The patient's certification status, so are they already certified as sight impaired or severely sight impaired? And this information can be very helpful in advance to the person in the low vision clinic receiving this referral. Which low vision aids have been tried previously and when, and which low vision aids are being used currently? And finally, fundus imaging can be helpful for the record for the person receiving that referral. Thank you for watching this episode on low vision referrals. Next time we'll talk about squint and ocular motility referrals. Thank you.